everyone, I'm Caitlin Edwards. I'm a certified personal trainer and I'm here to talk to you today about muscle recalibration. So muscle recalibration, what is it? It's treating the neuromuscular and myofascial relationships by lengthening the muscles under tension. So I'll get into a little bit of the science behind it and fascia in general. Fascial tissue is a web-like connective tissue structure that encases and connects muscle to muscle and muscle to bone. Fascia also encases motor nerves that innervate muscle fibers as well as sensory nerve endings. Issues within fascia can arise when fascia contracts, creating a knot, or when a tear occurs, creating scar tissue. Pain occurs as the sensory nerve endings are encapsulated and muscles do not work optimally as the neuromuscular communication is, in a sense, shut off. With muscle recalibration, we use eccentric muscle contractions to our benefit. As a protective mechanism, the body is stronger eccentrically. When slowing down the contractions and lengthening the muscles under tension, the body sends signals to recruit more muscle fibers. This allows breakthroughs in knots as well as scar tissue, freeing up sensory nerve endings and allowing the neuromuscular connection to once again communicate. This provides relief in pain, improved mobility, increase in strength, improved flexibility, scar tissue reduction, improved athletic performance, lymph flow, and structural improvement. So this method will help people who are with chronic pain and acute pain as well. It helps people pre and post surgery. It also helps people who have suffered from micro traumas and major traumas. Micro traumas being from everyday life with people working desk jobs or if you sit through traffic pretty often. This also helps people with arthritis, structural issues like scoliosis, degenerative diseases like Parkinson's, and it even helps athletes, just to name a few. So why not other modalities? Well, we know that modalities such as foam rolling and trigger point therapy and rolfing are even out there, and they have kind of the same, not the same approach, but they have some of the same benefits. And we choose muscular recalibration because we like to make sure that our clients and our patients aren't in pain. What we recognize with foam rolling, rolfing, and trigger point therapy is that there has to be an exact pressure placed on a point of tension in the body to get the release that we're looking for. Not enough pressure can result in no benefit. And too much pressure on a point of tension can create even more tension and more pain for the client or patient, and that's what we're trying to avoid. So with muscular recalibration, there is no pressure on a point of tension. So there's no pain throughout muscular recalibration for a client or a patient. Moving forward, we also recognize within muscular recalibration that the fascial structure is not a surface structure as the way it's treated within rolfing, trigger point therapy, and foam rolling. We recognize that fascia encases the muscles, innervates into the muscle fibers, goes down to the bone, and even encases organs so that they're able to glide across one another during movement. So with the idea that fascia goes down deeper and is not just a surface structure, we have an even greater benefit and even greater results with our method. Lastly, muscular recalibration is more of a holistic approach. We recognize that there may be a trauma or a point of tension that happens in the upper body, and it's going to affect the lower body as well. We like to use the towel to kind of demonstrate what happens. So when something happens in the upper body, we'll say that it gets twisted, the fascia goes to, we'll say there's an issue within the left shoulder. What happens is the lower body is also then affected. What we do is untwist the fascia, releasing the tension and bringing balance back to the entire body. That way We are no longer exposing the entire body to the possibility of injury, and we're relieving the pain, and we're solving the problem throughout the entire body versus just focusing on an area of tension. With muscular recalibration, it is our hope to create lasting changes within the body, and we do so by solidifying the changes we've made with strength training. We also encourage our clients to do maintenance sessions every now and then and to adopt a fitness lifestyle. I'm Caitlin Edwards with Muscular Recalibration, and I hope you all have a wonderful day.